Veterinary Eye Talk, let's go!
All right, good morning, everyone. Well, good morning for me. It's just a little before 7 a.m. and I'm not a morning person, so very, very lucky to have me here today, I should say. And I'm joined with my co-host, Ben Reynolds, who is over in the States. What time is it over there in Nevada, mate?
It's nearly lunchtime. I am a morning person, so I'm bright-eyed, bushy-tailed, but I'm also a big lunch person. So, yeah, very keen to get through this and get into some lunch. So, sounds good.
Yeah, fair enough, fair enough. So today, I know last week we spoke about cherry eye surgery, cherry eyes in general in the dog, and today we're going to do a little bit of a shift. And I know that we said that we'd review a paper and come back and talk about that, and we're going to have to curve that one till the next one, because today we're actually going to talk about feline dry eye. And we're really fortunate because Dr. Ben himself has been working on a textbook on not just feline dry eye, but feline ophthalmology in general. Why don't you tell us a bit about that, mate?
Well, thank you for the prelude, Paul. So, yeah, really, really excited myself and a bunch of other authors from around the world. So, authors based out of Ireland. So that's Dr. Natasha Mitchell, the UK, Dr. James Oliver, and a lovely Spanish lady who's also based out of the UK, Dr. Rosa Tedes Pont, working on this textbook together, basically just detailing feline ophthalmology front to bottom. So a really underserviced species, given how much we all see in contemporary ophthalmology practice of feline cases. But there's no dedicated textbook. So published by Wiley, getting released at the end of this year, so end of 2026. Still a really exciting project.
So I've got to say, I'm very excited for two reasons. One, it's going to be really good to have, as Ben suggested, a dedicated feline textbook. But two, I'm excited that I've already sat and passed my exams and that this won't make it into my reading years because there's already too much content out there. But no, that's super exciting. And specifically, you were telling me that you're working on the chapter on eyelids, the nasolacrimal drainage system, and tear production. So it sort of fits very well that we're talking about feline tear quality and quantity issues today with you, feline dry eye, because I feel like you're going to be at the forefront of information. Is that fair to say? Is that everything the chapter's covering, mate? Or
Yeah. So I'm doing a couple of chapters at the moment. That's the one I'm working on. So yeah, it's all at the forefront of my mind. So all those systems, if you think about them, like eyelids, third eyelid, nasolacrimal drainage, it's essentially making the tears, distributing the tears, and then draining the tears down to the nose. So all intimately associated, and thankfully makes writing about them all pretty intuitive as well.
And I guess to start, I mean, how often do you see a case of feline dry eye? Because I bet there's a lot of people out there listening right now who are thinking, I've never seen a case of feline dry eye, or I've never even heard of feline dry eye. And I think that would be a very reasonable sort of position to be in. I dare say there'd be some ophthalmologists out there listening who'd be saying, oh, feline dry eye doesn't really exist. What are these two people talking about as well? So, I'll start and say that I feel like it's a difficult thing to diagnose in my experience, and it is infrequent at best, or it is under-recognized, and perhaps we treat it as something else and it seems to sort of go away. Is that sort of your experience as well?
Yeah, absolutely. So it's a wonderful, wonderful introduction to it. I think that sums up my feelings pretty accurately. I mean, so for those who don't know, Paul and I did our residency at the same wonderful institution at Eye Clinic for Animals in Sydney, Australia. And similarly to most clinics, the Schirmer tear test was very much an optional diagnostic test for cats, based historically on old data that indicated that it wasn't a very reliable test. It was really difficult to use the information gathered from that test in cats and how to apply it, given that the autoimmune pathogenesis of dry eye in dogs, certainly wasn't replicated in cats. So hard to know what to do with that information. But also, cats are really stressed little animals in clinic, and you only have so many minutes with them to examine them, and you're really pushing the friendship, putting a strip in their eye for a minute. So for all the above reasons, historically, unless you had a really strong index of suspicion, you're going to find something. It's a test that we did not do. Since moving to Las Vegas, Nevada, working with a colleague, Dr. Will Weinstein, or Bill Weinstein, or William Weinstein, goes by a few first names. He Schirmer tested every cat just because that's how he was trained. And I couldn't help but notice he was diagnosing a lot of cats with insufficient tear production, which we'll touch on, I guess, what insufficient is in a second. But certainly much, much more than what I was appreciating, because, it's a test that I simply opted out of doing for many of my patients. So to your point, I think it is really underdiagnosed because the symptoms are much less severe of what we're used to seeing with dogs. But also, I think similar to, how we were trained and how I was practicing until, really very recently, like the last 6 months, very few clinicians routinely do Schirmer tests in cats.
Yeah, and I think part of the reason for that, I'm just making an assumption here, I guess, but certainly what I was taught was that, even if the Schirmer test is low in the cat, it's probably just that the cat's stressed. And there was a paper that came out, I believe it was Lionel Sabag who did that paper. And I can't remember what year, but I think it was 2016, 2015, around about that time. And they basically dispelled that myth, didn't they? And they found that even a stressed cat should be producing sufficient tears or an accurate sample, and that it won't be affecting the results. And that really changed the sort of game, I guess, a bit. And now it's a bit of a catch-up period where people are starting to recognize and treat it more. I think, in terms of cutoffs, what's your cutoff number? When are you worried about a cat's sort of tear production on the Schirmer?
Yeah. So just touching on that paper from Dr. Sabag first, if you want a good laugh, you can pull up that paper and you can actually click on the stimulus that they use to stress out the cats to see if it reduced their Schirmer tear test or not. And there's like a very funny pre-recorded dog barking noise that was, anyway, if you want to, it sounds like a torture method for cats, but anyway, all for the name of science. But yeah, anyway, very funny sound bite to listen to. So essentially the normal values for cats, anything under 10 millimeters in a minute is abnormal. So 9 or less is abnormal for cats. There's been basically from those papers, like from Dr. Sabag and his group as well. So all UHL et al. Did the big case series on dry eye in cats as well. But they did wonderful summaries of the literature, looking at all historic works from the 70s and 80s, and essentially like less than 1 or 2% of cats should have a Schirmer tear test rating that low. So it's, for some reason, it was sort of written through the annals of literature that cats sometimes just get these low readings and it's hard to interpret. But following up on the data, like these guys who went back and looked at all the old papers found that actually it was a really, really low percentage of cats have these abnormally low readings, which we now recognize is abnormal. Like it shouldn't just happen transiently.
And you mentioned that, the pathogenesis of dry eye, as we think about it, I guess, in the dog, or KCS, as I think it should be more appropriately termed specifically. And we'll talk about that a bit more in the canine dry eye. But you mentioned that that's, usually related to and sort of an immune attack on the tear production, the tear producing glands. And in cats, that's not really the case. What is the most common sort of pathogenesis for feline dry eye?
Yeah, so the current theory is with feline herpes virus recrudescence, which, as we know, up to 95% of cats are seropositive for feline herpes virus. But with recrudescence, the little virus particles activate in the corneal sensory nerves of the trigeminal nerve, and essentially the subbasal nerve density in affected cats is significantly lower than those that are unaffected. And that's been replicated. It was a different paper by Dr. Sabag in Israel who demonstrated that. But yeah, essentially the thoughts are, if you've got altered corneal sensation from these recurrent flare-ups of herpes virus, then there's less efferent input in your nasolacrimal secretory unit or lacrimal functional unit, so that your little gland isn't getting the signals to produce tears. So normally our cornea has these sensors that say, hey, like I'm a bit cold because there's not enough tears, or I'm a bit dry, or my osmolarity, the salt concentration, isn't quite right, and that should stimulate our lacrimal gland to create tears. If we're not getting those sensations because these cats have had chronic herpes virus flare-ups, then the tears aren't going to come. So it's inherently a different pathogenesis to dogs. And with that in mind, some of the treatment options aren't as effective that we see in dogs. In cats, rather, they're not as effective than what we see in dogs, or not as predictably so. Essentially, as we know, the mainstay of treatment for dogs are things like tacrolimus or cyclosporin, which both are T-cell inhibitors. So for the autoimmune pathogenesis are really useful for dogs, and they have a secondary component where they directly stimulate the gland to secrete tears. In cats, again, there's only been a really small case series following up treated cats, which is by Dr. Ull, where essentially the treatment response was much more variable and the benefit much less clear using things like cyclosporin and tacrolimus, but rather just trying to re-establish the barrier health of the cornea, so using things like topical hyaluronic acid or sodium hyaluronate, same thing, is probably the most useful treatment.
I think the thing that I find really challenging in these cases is, and it depends, I find it that how I can get a hold of them is really dependent on the cat's temperament, because often you've got a cat that's coming in, it's had herpes virus flare-ups, and they may be stressed out by the very act of putting eye drops in. And so then you end up in this cycle, and I've actually got a case just like this at the moment where I start to treat the dry eye, and then invariably it starts to get flare-ups of the herpes virus, and suddenly you can very understandably from the owner's perspective, they're like, well, these drops aren't doing anything, they're making things worse, and we'll stop the drops and things will kind of get better for a time. And so we end up in this vicious cycle, and I think that's potentially played a role in why this is I can't even think of the right word for it, but perhaps why this area receives a bit of controversy, because I've seen cases where topical lubricants really benefit, and then I've seen other cases like that where we just end up in this vicious cycle and I don't even know the answer. The other thing that I think gets challenging with this is I also get the odd cat, and I'm sure you've had this as well, where you Schirmer tear test it and its tear production is less than 10, less than 7, but it's otherwise completely fine. It's sitting there, doesn't appear to be in any discomfort. And then the question is, well, what do I do about that case? Do I supplement it with tears? Do I not? And I think that's a question that actually no one really knows the answer to. I remember talking to David Maggs about it from UC Davis when he was out in Australia. For those who don't know, he's Australian, so represent. And he was talking about that issue when he was presenting at a little conference in Australia to the ophthalmology chapter, and it was really interesting. And you sort of had a room of 20 people all talking about this one issue, and it was very hard to come to any sort of consensus. And his feedback to that was, well, yeah, it's I don't think we know, and we don't really know what to do with subsets of cats. Interesting, going back to the pathogenesis of it, I definitely feel like that, and the way I sort of liken this in my brain is, if you see those those cases of the brachycephalic dogs that have the severe pigment, And after a while, they get to a point where, you might have a really severely pigmented eye, and it might even Schirmer, close to normal. But you're, you're still getting all of the signs of dry eye versus the other eye, which is okay. And I wonder if it's a similar thing where that, severely altered cornea, that pigmented cornea that's been chronically inflamed, it's, the nerves, as you described it, that are inhibiting that one, and that's why we're seeing a unilateral. I mean, it might not be the case, but I just think, it's good to keep in your mind that severe corneal pathology, or any corneal pathology, particularly sustained over a long period of time, is going to have an effect on these things, as you can imagine. But yeah, so I guess going on to it, you've spoken a little bit about treatment. I feel like I'm quizzing you today because the reality is, I think Ben knows a lot more. Whether he'll admit it or
Oh,
not,
I don't know. That's definitely not true. It's definitely not true. But yeah, mate. I mean, well, I'll flip the script. I'll ask you, what do you do to treat
Oh yeah,
these
sure.
things?
Yeah, and I said before I'd end up in a vicious cycle. No, I think it depends how they present, and often um when I think about it, often they present and in my experience, they'll present as uh cases that have been presumptively and rightfully so, because there probably has been a herpes virus component for basically chronic herpes, or maybe even ulcer that won't get better. And we'll finally get on top of the herpes virus and the cat will still be uncomfortable. And that's often when I'll Schirmer tear test them. I mean, I tend to avoid, if there's an active ulcer, I tend to avoid Schirmer tear testing for a number of reasons. Perhaps I should be putting the Schirmer in, but I just, more so than anything, I'm putting local in pretty much immediately before the exam because they're uncomfortable. And so then, I guess you could then go on to say, well, why don't you do a Schirmer tear test 3, which, to just give you guys a bit of background on that, that's when you stimulate the trigeminal nerve effectively, in order to, by putting a noxious stimuli at the nose with the Schirmer tear test in, with the cornea, with a topical anesthetic put on the cornea, to see if the gland is, I guess, capable of it's more of a test of function, as I understand it, of the gland, as opposed to testing whether or not it's receiving that input. And so I could do that, but it's hard then, again, as Ben said, the challenges of a cat in the consult room sticking an alcohol swab in front of it, particularly, before you've done most of your meaningful exam. That might be the last thing you get to do with that animal for that day.
Absolutely.
So I feel like for me, the diagnosis often comes after I've been mucking around treating them for something else, usually herpes virus or presumed herpes virus. And the ulcer gets better, but the cat just doesn't seem to improve in comfort. And that's when I start to reach for, things like cyclosporin I often try. And as Ben said, hyaluronic acid-based lubricants. And I've got to say, my success has been very variable. I see some owners who come back and they're like, oh, $1 million working much better. And then I see others where, as I said, we end up in this circle, and it's usually the ones where the cat really, really doesn't like receiving eye drops. And then I feel like I'm kind of, you're in trouble there, because what do? You know what I mean? Do you stress the cat out twice a day or 3 times a day even to put an eye drop in? Or do you just sort of say, okay, let's just take a step back and see what happens here? And it's a hard call to make.
Yeah, absolutely. I think, to your point, I should touch on, like, your mentioning of using things like cyclosporin or tacrolimus. Like, undoubtedly, there is an inflammatory component to these. So even if there's no benefit in mediating immune-mediated destruction of the lacrimal gland, I still think it's very worthwhile, even short-term, until hopefully we can get these Schirmers resolved by improving that barrier function of the cornea, and hopefully improving corneal health. Using things like tacrolimus, cyclosporin, or short-term non-steroidal anti-inflammatories, things like that, I think are really useful. Something I guess I'll touch on, and this is just more a thought than anything else, but to your point, like it sounds like your treatment is based purely off symptoms, which is really justifiable, and how most medicine I think should be done as well, as opposed to numbers. So if you had an asymptomatic cat with a Schirmer of 5, is it worth treating that animal versus you had a incredibly symptomatic cat with a Schirmer of 8? I guess something that we don't know as a profession. So this is my Great Dane just saying hello. Something that we don't know as a profession, and I'd be very interested in knowing, is things like lifetime risks of things like corneal sequestrums or risks of recurrent ulcerative keratitis events with herpes if you're a dry eye cat. There's no proof to suggest that cats with reduced tear production have an increased lifetime risk of sequestra or increased incidence of ulcerative keratitis if you're seropositive for herpes. But I suspect they would. I guess there's theoretic evidence that they would, and so therefore treating the lower Schirmers, even if they're mildly symptomatic, is probably of benefit. But yeah, for any very motivated, keen residents or interns out there looking at doing some serious longitudinal data with some of the new information collecting softwares and stuff out there, I think that would be a really useful thing to know. But yeah, at least certainly theoretically that would be of benefit to treat those animals for that reason, even if mildly symptomatic.
Yeah, it's a good point. And actually, now that you mention that, if you think about what most people do, or I shouldn't say most people, I don't know, what most people at our clinic or my clinic now do in a case, and I wonder if this is true in other places. Maybe you can tell me if Dr. Weinstein does this, but you get a cat that comes in and has a corneal sequestrum, and you treat it surgically, and we'll talk about that another time. And the owners come back and say, well, what can I do to stop this from happening in the other eye? Historically, I think what I've seen, the reflex is, well, there's nothing I can really give you that's guaranteed, but why don't you try putting this lubricant in twice a day, because it probably won't hurt. And so subconsciously, maybe, we're already sort of thinking, okay, well, why is it developing a sequester? There must be some sort of a tear quality at least, or quantity issue, or it's involved in some way. And, delving deeper into the issue of sequestrums, I guess the most common animals or the most common breeds that we see with sequestrums, at least in Sydney, tend to be those brachycephalic animals like, Persians are the sort of the poster child over here. And we know that, brachycephalic ocular syndrome, if you've got a more prominent eye, all of those sorts of things, you're going to have, at the very least, sort of differences, I should say, maybe not issues, but differences in your tear film quality. There's just no doubt about it. So I feel like it's a really good point. At what point do we start to treat those asymptomatic cats? And it's a hard one. And I think, I'm going to go back to, I think it's also patient dependent. I mean, my cat at home, I've got a Burmese who you've seen on the last episode. She's pretty relaxed about everything. Putting an eye drop in her eye, 2-3 times a day, it's not going to be an issue. I just, I can get her at some point. I mean, she won't love it, but she's pretty compliant. But, we get some clients who, for them to put a single eye drop in a cat is like a 3-hour event where they're trapping this cat, they're wrapping them in a towel, and it's, all bets are off. And I think in those cases, it's hard to justify. And those cases are the ones that I find, I feel really defeated, because if they do need something, I mean, and this doesn't just go for dry eye cases, but for any, be it an infected ulcer, those cases are very challenging to medicate, because we kind of just like, well, what do we do about it? How do we even treat the problem?
Yeah. It's one of those frustrating, more than most other conditions I think we're going to talk about in this podcast series. I think there's no consensus. I think both of us have feelings, but not really strong feelings about how often Schirmers should be done or how to treat them. And it's just, I don't know, it's an interesting update, I guess, on what is a very, very common condition in dogs, a very rare condition in cats. In recent years, the profession has more of an understanding on, and I think it's interesting to share with the broader veterinary community, I guess, the information update, even if we as a profession of specialists, we don't have a consensus statement on how to treat them, or I guess the ongoing implications of affected animals, even though we suspect they probably are going to be more affected with subsequent corneal disease.
So I guess like not a summary, a bit of a summary, but I guess, the way I approach it is if you can safely get a Schirmer-Tear test without, getting scratched, bitten, or ruining the rest of your exam in a cat, I think do it. I can't think of a good reason not to, bar a very deep ulcer or something. Obviously, all those same rules apply. But I think if you can do it, then do it for sure. If you get that result and you're a bit perplexed on exactly what to do with it, don't feel disheartened. I think if it's less than 10 as a fair cutoff or as the cutoff, you probably can't harm the cat, I'd say, or you're not going to do any harm, starting treatment with something like and if you're unsure on what to use, I feel like a hyaluronic acid is probably the safest thing. Is that fair to say, Ben?
Yeah, absolutely. Yeah.
On the topic of anti-inflammatories, I will dial back a bit, but you mentioned topical non-steroidals, and I think I know why you probably would reach for that over something like a topical steroid, but I guess for the general audience, is there a specific reason?
Yeah. Great leading question, Paul. Thank you. But yeah, so as we know, up to 95% of cats are seropositive for feline herpes virus. We're talking about a subset of animals that are even more likely to have feline herpes virus and have a history of recrudescent disease. Topical steroids have a really potent local anti-immune effect, and so your normal immune surveillance for little virus particles flaring up the keratitis, if you're suppressing that, you're much, much more likely to get recrudescent ulcers. So herpes ulcers are more likely to come. And then, heaven forbid, but if you had an ulcer and you were still applying it, then leading to things like chorotomalacia and whatnot, and bacterial occupation of those ulcers is going to be much more common as well.
And I think it's important to note that there are still risks with using topical non-steroidals in cats. But I, just like Ben, even if I do cataract surgery on a cat, and I'm sure there's a million cataract protocols out there, so don't take this as gospel. But I am a bit nervous after surgery. If I feel the need to reach for a topical steroid, I'm going to do so in probably the lowest amount that I can, and it's for that reason. Because the last thing I want is to get an ulcer and then be trying to manage an ulcer and inflammation in the eye at the same time. And that's a
nightmarish
nightmare.
Combo,
the only combo that gets worse is when they have glaucoma as well. But so I think that's a really important point, and that's why historically, particularly if it's been a longer term thing, rightly or wrongly, I've sort of gravitated towards cyclosporin. But it's not, there's definitely no there's no clear consensus, and there's no really simple formula we can give you. The last thing, actually, that's just popped in my mind now about retesting. I mean, the typical sort of process when we diagnose a dry eye in a dog is, as I'm sure all of you out there know, we'll stick a Schirmer-Tear test in, and a dry eye, I should say, keratoconjunctivitis sicca. We'll whack the Schirmer-Tear test in. We'll get our low value, somewhere below 15 with our signs. We'll start, whatever drug of choice it is, and that might depend on what the prescribing laws in your country are, or state even. It could be Optimune, it could be cyclosporin 2% or something like that. It could be tacrolimus. We won't delve into that. And then, depending on which lycostimulant you're using, a certain amount of time later, you'll be retesting those tears. And, if you're lucky, the first drug you use, you'll get that value of 15 or above, and you'll have owners that are ecstatic and the dog will look a million times better. I feel like that's not the case with these cats either. I mean, in your experience, are you retesting the tiers and seeing a huge improvement, or is it more just you're getting feedback from the owner that the cat's more comfortable?
Yeah, a little bit of both, and I'll always retest again unless patient demeanor doesn't allow it. But yeah, often they will improve, possibly not as dramatically as dogs do. So, we are used to seeing dogs where at the recheck appointment, their Sherma values triple, like they might go from 6 up to 18, and that's not an uncommon finding at all. Whereas our cat with a Sherma tier test of 7 maybe will push it all the way up to 10, and then we're all feeling really good about it. But yeah, so the improvements aren't as dramatic. They're probably not as predictable. So, published success rates with treatment of KCS in dogs is like 80 to 90%. Well, 80% for non-severe cases with 0.2% cyclosporin. A little bit higher from other studies with other drugs, but with cats, it wouldn't be nearly that high. Like, just purely anecdote in my own cases, probably 2/3 of them you can sustainably get into normal values, and then 1/3 of them either don't respond, or sometimes you check them and they're a little bit low, sometimes you check them, they're a little bit high, in which case just offering tier supplements is probably lowering lifetime risk of things like ulcers, sequestrums, etc. But yeah, not returning them back to their own ability to create sufficient tiers, unfortunately. Yeah, I wonder if, and again, completely unexplored, but for a certain subset of dry eye in dogs, we use things like pilocarpine orally. It's something I've never used in a cat. It's interesting, like for refractory cases, whether how well they would tolerate something like that. I'd have to do more reading into, but yeah, I suspect there's going to be more publications in the future looking at specific treatment protocols, whereas at the moment, as a profession, we've sort of just got to the point where we can classify cat dry eye, and the exact treatment protocols and expected outcomes are yet to be determined.
So maybe I'll watch this space. In a year, we might be telling you about a fancy new drug or treatment protocol.
Yeah, that's right.
I'll chuck this in and it'll all be fine. Yeah, all right. Well, I think a shorter episode today. We sort of rambled a bit last week, and I apologize for that. Ben and I have never been shy of a long conversation. So I reckon we wrap it up there. So Ben, late 2026 for the textbook. I'll just do a shameless self-promotion here. And what's the title? What are we calling it?
Yeah, unfortunately, Paul, I don't think there's going to be many sales, so commission for you plugging us might be pretty slim, I'm afraid. So yeah, sorry, Em, no new shoes for you based on Paul's plugging. But yeah, it's called Feline Ophthalmology, published by Wiley. And yeah, expected to come out end of 2026. Both myself and a wonderful cast of authors from the UK and Ireland, so should be terrific.
Fantastic. Actually, I believe I recall you telling me your proceeds are not going to the personal bank account. So Ben's, it's a labor of love plus. What are you doing with your sort of your small earnings?
Yeah, not that I anticipate it's going to be a huge sum of money, but yeah, I as Paul knows, but a large portion of our residency training was at the RSPCA, which for anyone overseas listening is Australia's largest shelter group for dogs and cats who aren't fortunate enough to have a home yet. So a large portion of our residency training was at their largest facility in Australia, in Sydney. So we have a close relationship with those guys there and think they do a lot of good work. So my portion of proceeds are going to be donated to the RSPCA in New South Wales. So hopefully they'll do some good there.
So go buy a book. Don't just pirate it. All right, guys. We'll wrap it up there. Thanks for joining us, and we'll see you all next week. Thanks, Ben.
Thanks, Paulie.